transmission. Chlamydophila spreads from person to person. Chlamydophila psittaci is acquired from infected birds like parrots, typically parrots. A characteristic extrapulmonary feature of psittacosis is splenomegaly. A characteristic extrapulmonary feature of psittacosis is splenomegaly. The most common viral cause of pneumonia is Tell me. 25. Swine flu H1N1 is now covered by the 21. Pneumocystic pneumonia primarily affects patients. 27. A causative organism of pneumocystic pneumonia was previously known as 28. A common radiological feature of pneumocystic pneumonia is 24. I know you got the answer. Let's just go to the answer straight. Influenza the most common viral cause of pneumonia is influenza. We did this question before. Annual flu vaccine. Swine flu H1N1 is now covered by the annual flu vaccine. Pneumocystic pneumonia primarily affects patients, immunosuppressed patients like HIV patients. The causative organism of pneumocystic pneumonia was previously known as Pneumocystis carinii, now known as Pneumocystis jirovecii. Good. A common radiological feature of pneumocystic pneumonia is bilateral perihilar interstitial shadowing. Bilateral perihilar interstitial shadowing is a common radiological feature of pneumocystic pneumonia. 29. Severe pneumocystic pneumonia requires treatment with cotrimoxazole and 30. Prophylaxis for pneumocystic pneumonia is indicated if CD4 count is below steroid. Pneumocystic pneumonia requires treatment with cotrimoxazole and steroid. Pneumocystic pneumonia or severe pneumocystic pneumonia or pneumocystis jirovecii. Remember, we are giving high dose cotrimoxazole and now we are adding steroid. So 200 per millimeter Q is the answer for 30. Prophylaxis for pneumocystic pneumonia is indicated if CD4 count is below 200 per millimeter Q. 31. A 68-year-old alcoholic presents with fever, pleuritic chest pain, and lobar consolidation on chest X-ray. What is the most likely diagnosis? I'm not telling you. 32. A 30-year-old male with influenza develops bilateral cavitating bronchopneumonia. What is the most likely causative organism and treatment? A 70-year-old diabetic man developed upper lobe pneumonia with cavitation. What is the most likely diagnosis and first-line antibiotics? Okay, we are going to the answer now. Are you prepared? I know you got it. 31. Pneumococcal pneumonia. Yes, you aced it. A 68-year-old alcoholic presented with fever, pleuritic chest pain, and lobar consolidation on chest X-ray. The most likely diagnosis is pneumococcal pneumonia. 32 is Staphylococcus aureus. Treat with flucloxacillin plus or minus rifampicin. For the 35-year-old male with influenza that developed bilateral cavitating bronchopneumonia. Staph aureus is obviously the cause of bilateral cavitating bronchopneumonia, and the most likely that's the most causative likely organism, and the treatment is flucloxacillin plus or minus rifampicin. And if severe or you confirm MRI say you had vancomycin. The next one is Klebsiella pneumonia. Treat with cefotaxime or imipenem. A 70-year-old diabetic man develops upper lobe pneumonia with cavitation. What's the most likely diagnosis? And first line antibiotic, that's Klebsiella pneumonia, and we are treating this patient with cefotaxime or imipenem. A 27-year-old presents with dry cough, myalgia, pharyngitis, and hoarseness, followed by pneumonia. What is the most likely organism and treatment? A 45-year-old HIV positive man presents with dry cough, exceptional dyspnea, and fever. Chest X-ray shows bilateral perihilar interstitial infiltrate. What is the likely diagnosis and treatment? I've given you the idea already. I just wanted to ace it. 34, his chlamydophila pneumonia treats with doxycycline or clarithromycin. For the 27-year-old who presented with dry cough, myalgia, pharyngitis, and hoarseness, followed by pneumonia. The most likely diagnosis we're giving this patient is chlamydophila pneumonia, and we're treating with doxycycline and clarithromycin. And the last one is pneumocystic pneumonia or pneumocystic jirovecii, and we're treating with high-dose cotrimazole plus or minus steroid. So the 45-year-old HIV positive man presented with dry cough, exertional dyspnea, and fever. The chest X-ray showed a bilateral perihilar interstitial infiltrate, and the likely diagnosis is pneumocystic jirovecii and treating with high-dose cotrimazole plus or minus steroid. A 70-year-old diabetic patient presents with fever, pleuritic chest pain, and dry cough. Chest X-ray shows lobar consolidation. What is the most likely diagnosis, and what antibiotics should be started? Another 37, a 35-year-old bed handler develops fever, headache, dry cough, and splenomegaly. What is the most likely diagnosis? 36 is pneumococcal pneumonia, and treatment is amoxicillin, benzylpenicillin, or cephalosporin. So, the 70-year-old diabetic with pleuritic chest pain and productive cough, chest X-ray showing a bilateral, chest X-ray show bilateral lobar consolidation, shows a lobar consolidation. We said the most likely diagnosis is pneumococcal pneumonia, which is the most common organism that causes this. And the antibiotic we are starting this patient on is amoxicillin, benzylpenicillin, or cephalosporin. And 37 is Chlamydophila psittaci infection or psittacosis. Bed handlers, gives an idea. For the 35-year-old bed handler that developed headache, dry cough, and splenomegaly. Well, I think you should tell me the treatment you're giving the patients. With psittacosis, the next one is 38. A 25-year-old man presents with flu-like illness followed by dry cough, and he reports malaria and myalgia. Chest X-ray revealed by basal consolidation. What is the likely pathogen? I probably want you to add the treatment. Next, a 55-year-old man with HIV presents with high fever, dyspnea, and bilateral capitation. Chest X-ray shows bilateral perihilar interstitial shadowing. What is the most likely diagnosis and treatments? I know you got this. 38, Legionella pneumophila. For the 25-year-old that presents with flu-like illness followed by dry cough and has reported malaria with myalgia. And the chest X-ray revealed a basal consolidation. The most likely pathogen we are suggesting is the Legionella Pneumophilia. And the treatment I asked you to tell me, I'm not going to tell you. We discussed it. 39 is high dose cotrimazole or pentamidine steroid if hypoxemic. So the 55-year-old man that presented with fever, dyspnea, and bilateral crepitation, chest X-ray showing interstitial shadowing, the most likely diagnosis is pneumocystic jirovecii pneumonia. And the treatment we are giving this patient is high-dose cotrimazole or pentamidine with steroids if the patient is hypoxemic. The last but not the least question, scenario, a patient with cystic fibrosis presents with cavitating pneumonia and bilateral bronchopneumonia. What pathogen is most likely and what antibiotic is appropriate? You're not going to miss this. You are getting this question. Oh, I know you got it already. Pathogen is Staphylococcus aureus and the treatment is flucloxacillin plus or minus rifampicin. For methicillin-resistant Staphylococcus aureus, you can add vancomycin. Thank you. Please like my video, subscribe to my channel, and share it with your friends. See you in the next video.